Hi everyone, it's Dr. Mazar from Men's Medical Clinic. We're a specialist TRT clinic in Leeds, and today we're going to talk all things about estrogen management on TRT. So estrogen, firstly, is a very important hormone for men's health. Although traditionally seen as a female hormone, it's very important for men as well. So it helps regulate symptoms such as mood, such as libido and sex drive, and even erection quality as well. As well as that, it's important long term for issues such as cardiovascular health and bone health. So it's important to have enough estrogen in the body, and you don't want it to be too low either. Now, when you start testosterone replacement therapy and you inject exogenous testosterone, some of that will be converted into estrogen via an enzyme called aromatase. So that's normal, and we expect the estrogen levels to go up on TRT. Now, on your blood tests, when you look at your blood tests that your doctor might organise, you'll see estrogen is called estradiol, which is a biologically active part of estrogen. So that's why there may be a difference in the name. Now, when do you need to do something about your estrogen is when you've got symptoms or side effects. So, for example, if you have mood swings, if you have acne or oily skin, if you have gynecomastia, so that could be nipple pain or sensitivity, or it could be the development of female breast tissue. So these are all kind of signs and symptoms that you may need to do something about the estrogen. Water retention, that's another common one. So it's important, if you do experience any of these issues, to speak to your doctor to get specific advice. Now, here are 6 ways to manage the estrogen very quickly. So number 1, lifestyle choices. So for example, reducing alcohol. So alcohol increases the activity of the enzyme called aromatase, which once again converts testosterone into estrogen. So if you've got high alcohol intake, especially chronic alcohol excess, then managing that may be enough to manage your estrogen. Number 2 is losing body fat. So once again, the higher body fat you have, the more aromatase enzyme you have, and the more testosterone is converted into estrogen. So once again, if you're high in body fat and you're on TRT, watching the diet, exercising can be one of the easy ways to manage your estrogen levels. Number 3, and a very common mistake I see, is that the TRT dosage is too high. So you often get cookie cutter TRT approaches where a patient's on 200 milligrams or even more of testosterone, and of course a lot of that will be converted into estrogen. So sometimes you might need to lower the dose that you're on to manage the estrogen symptoms. Number 4 is to review the dose of HCG. So HCG mimics luteinizing hormone, and it's used to preserve fertility and to preserve testicular production of testosterone as well. The problem is the testosterone made in the testicles stimulated by HCG is very, very potent, and a lot of it can be converted into estrogen once again by aromatase activity, which is more active in the testicles. Number 5 is microdosing, so consider the injection frequency. So rather than have one big dose of testosterone per week, you might reduce the dose and do it 2 or 3 times a week, or you might do small amounts every single day, which is called microdosing. So the whole point of it is you get less peaks, you get less aromatization of testosterone into estrogen during the peaks as well. And then finally, the last thing that you can do to manage estrogen is an aromatase inhibitor. Too often you see some cookie cutter clinics where every patient is prescribed an aromatase inhibitor. Ideally, aromatase inhibitors such as exemestane and anastrozole should only be used as a last resort and for as short as time as possible for patients. The problem with aromatase inhibitors is you can experience side effects, particularly long term. So you get poor lipid profiles, poor cardiovascular health, and eventually poor bone health as well. So only use aromatase inhibitors in certain cases and when all the other 5 steps have been attempted before you jump to aromatase inhibitors. So I hope that's been useful. It's just a quick video on managing estrogen on TRT, what's normal, what's not normal, when to treat it, and some easy fixes before you jump to aromatase inhibitor. Just remember, this isn't specific medical advice. Always speak to your doctor and get some specific medical advice before you jump on any testosterone replacement therapy, aromatase inhibitors, or you start changing the doses. So always speak to your doctor and get personal medical advice.